As you will have seen, we have had a border case of a managed isolation quarantine worker reported today. Dr. Ashley Bloomfield has provided a briefing on that already this afternoon. So my intent today is to focus on the 23 cases that we've seen at our borders today, 17 of which have been reported as having arrived from India. While New Zealand continues to enjoy effective elimination of COVID with no community transmission, the same is not true of the rest of the world. In fact, World Health Organization global reporting shows that in just the last month, cases of the virus have been on the rise again internationally, after falling steadily over January and February, with surges in cases particularly in Brazil and India. Parts of Europe are going back into hard lockdown after a spiking of cases, with the highly transmissible UK strain taking hold and spreading throughout the continent. We are starting to see this global trend mirrored locally in those arriving in New Zealand. Through late January until recently, our 7-day daily average of cases in managed isolation had been sitting at roughly 2 to 3. This was obviously a manageable level of cases, and it's not placed significant strain on our system or indeed on our specific quarantine facilities. However, since March, the rolling 7-day average has steadily risen to around 4 to 5 cases a day, and yesterday the rolling average was 7, a high we haven't seen since October last year. As we know, New Zealand is not immune to the virus, especially with an active pandemic raging outside our borders. It has been our strict border defences that have helped to keep COVID out, and it is to the border we again look to manage this global spike. Over recent weeks, the government has been reviewing our border settings to better understand what we can do to better manage the risk as we see this surge offshore. While day zero testing is picking up cases immediately and moving people to quarantine, which reduces risk of transmission, ultimately we do want to see fewer cases arriving in general. As we've said all along, pre-departure testing, whilst a helpful tool in this regard, is not fail-safe. Advice is that people are likely getting the virus following their test as they travel to the airport and before they board a plane. As such, I have asked officials to provide me with advice for the improved management of arrivals from high-risk countries. In the interim, I am announcing that we are temporarily suspending entry into New Zealand for travellers from India. This will take effect from 4 p.m. on the 11th of April, this Sunday. That allows us time to draft the legal orders that will be required. This temporary suspension will remain in place till the 28th of April. I want to emphasise that while arrivals with COVID from India has prompted this measure, we are looking at how we manage high-risk points of departure generally. This is not a country-specific risk assessment, but of course a risk assessment generally to ensure we better manage the number of cases that are coming in from those countries that are experiencing a surge. During this temporary suspension, the government will investigate options to manage risk, and while, though, we have put in place previous travel bans on countries, we have never previously suspended travel to New Zealand citizens and residents. That's why I do want to assure you this is not a permanent arrangement, but rather a temporary measure until we are able to better understand and manage the current situation we are facing, and to see if there are ways to reduce the risk that actually travellers themselves are facing as they embark on their journeys to New Zealand.